All right. Hello, everybody. Light doesn't look great. I'm going to change the light. Bear with me 1 second. How is that? A little better. It's not hugely different. Welcome to the live stream. My name is James. I am a movement coach specializing in the brain and nervous system. If you are new to this kind of channel, you can find videos on all aspects of movement, whether it's to do with skill acquisition, pain, and injury. If you want to take a deep dive, if you're new to this Rewire series, this is basically a collection of episodes based around the kind of initial consults that I have with people. So usually before I work with someone, I like to chat to them a bit, and based on the questions that consistently come up, I decided I would just put them all online and have people able to access them rather than needing to, book a time slot and stuff. So if you resonate with any of this stuff and you're considering that we might be able to do some work together, then maybe you'll have a little bit more information after you watch this video. We're going to be talking about pain today, and pain's a little complicated, so there will be a few videos in this series on pain, but right now we're talking about self-management. So what can you do to manage your own pain, or what can you learn about pain that actually helps you deal with it in a healthy way? The reason this is useful in pain management theory, since I started to look at this, there was a time where we would have thought medication and surgery were like the two most effective strategies. Nowadays, that's changed somewhat. Nowadays, it's more likely to be recommended that the two things that are best for managing your pain are movement, number one, and actually education. So, education on what pain actually is. This is a really weird thing because a lot of people say, well, I know exactly what my pain is, but it's actually a little bit more complex than you think. So, what I'm going to do in this video today is I want to talk, first of all, through 4 principles of pain that you need to understand. These are just for you to kind of take, digest, think about uh, as you go through your life, and that might result in your relationship to pain changing. It might result in you being less worried and anxious when pain and injuries come up, because statistically, the majority of time when you're dealing with a pain complaint, there is not a huge amount to worry about. Most pains resolve themselves after a short amount of time. Most injuries resolve themselves after a short amount of time. And the thing that tends to make things a lot worse is actually our stress response that we have to the pain. So when we're always assuming that pain is something highly dangerous that we need to get sorted ASAP, or it's going to be really bad, that tends to be what causes the majority of the problem. So we'll look at those 4 principles. After that, I want to talk about 6 practical strategies that you can use to self-manage your own pain. Obviously, there'll be a bit of a caveat as to, when do you actually need to go and get checked. Sometimes we are going to need a diagnosis. We are going to need to put a label on the problem. I'm absolutely not going to say, hey, you break your arm, here's how to self-manage that. I wouldn't recommend doing that via YouTube or anything else. Sometimes we do need to get that second opinion, so we'll talk a little bit about that as well. All right, so don't want to make this too long, so let's just jump right into it. 4 principles of pain that you need to understand to help you have a better relationship with pain and with injury. Number one is the idea that pain is effectively an alarm. So when you're trying to define pain, a lot of people think, if my finger hurts, the pain is the thing that comes from the finger up to the brain. And actually, that is incorrect. It's the other way around. Something comes from the finger up to the brain, but pain is the thing that goes back down to the finger. So when you're experiencing the sensation of pain in your finger, it's because the brain has sent a signal down the way, not because the signal has come up the way. That's really important to understand. It doesn't mean that the signal on the way up isn't important. It's just important to clarify that the signal that comes up is not pain. Think about this a little bit like you would consider a fire alarm. The alarm sound isn't the thing that's causing the damage to the building. The fire or the smoke is what's causing the damage. The fire or the smoke is most of the time what's triggering the alarm, but they're two very different things and they have two very different purposes. The fire is doing its own thing, it wants to burn the building to ashes. If you could put a human motivation on it. The alarm is there to tell people to get out of the building. Not even to tell people there's a fire. When you hear a fire alarm, your instinct is, I need to get out of the building. And that can be important too. If you heard a fire alarm, there could be loads of reasons why somebody has triggered that alarm. It could be a prankster. It could be that somebody thought they saw a fire. It could be that the smoke detectors have detected smoke, whether that's a fire that's dangerous, whether it's not. It could even be, maybe your building just has one alarm system and, there's a burglar or a terrorist or something else inside that results in the security staff wanting your building to be evacuated. And they don't need to say, oh, well, let's make sure we got the right alarm. We've got an alarm that gets everyone out of the building. We don't have to be any more accurate with that information. So that is quite a good analogy to how pain works. We can experience the alarm from pain for a number of different reasons. There are so many different reasons and they're so complex that we can't really get into it here. But we do just need to clarify that, pain, the signal of tissue damage, of threat, danger, pressure, all of these things could come from the joint. Your brain could also be getting signals that, are coming from somewhere else in your body, or coming from elevated stress levels, or coming from many, many different things. So your brain is giving you that alarm to tell you something. It's not necessarily telling you that you have tissue damage in your finger. We can't be so conclusively accurate about that. Really, all the signal of pain can tell us is your brain wants you, for some reason, to pay attention to that area. So when we think of pain as a signal, it's useful to think of it as an alarm telling you to pay attention. And then if we want to figure out what's going on, we need to start building more and more evidence. If we see, my finger's bleeding, or I've had an injury to my finger previously, that might give me some good data to tell me, okay, well, this is what's going on. Maybe I'm doing something else. So maybe I've got pain in my finger because I'm using it too much, because I've actually got an injury somewhere else. And this is one of the reasons why an alarm signal is helpful. What if I'm doing press ups and something cuts my other hand clean off, and now suddenly I'm leaning all the way on this hand, but all the nerve receptors on this side have been incapacitated somehow. I don't know what's cut it, but in this hypothetical situation, I've cut my hand off and I've completely damaged all the nerve receptors, so they can't actually send any signals up and down. In that instance, then I start to use this finger more and more, and the brain goes, "This doesn't make any sense." So I'm going to say, "Hey, pay attention to this area." You see this in phantom limb pain and stuff, where somebody's actually had their limb removed. The brain's trying to fire signals down to the hands, But because you don't have a hand anymore, those signals just keep bouncing back saying, yeah, not sent, not file not found. And your brain's going, well, what's going on? I better get them to pay attention to that zone. And so it fires that pain signal so that you try to pay attention to your fingers. And again, makes it very complicated when there's nothing to pay attention to. But that's basically principle number one in a nutshell. Pain does not mean damage. Pain is the alarm signal that tells you to pay attention. Principle number two about pain that we need to understand is that pain is both a sensation and an emotion. This one is pretty important as well, because we can experience pain differently depending on the state of mind that we are in. Usually, when we think of pain, we think of the sensation that we feel, but how we feel about that sensation actually affects the intensity of that pain overall. So, the best analogy I could give you for this one is going to be temperature. You can feel cold and have that be a really, really good thing, or you can have it be a really, really bad thing. On a cold day, when you go outside, you get that instant sadness. You're not enjoying the feeling that you're getting from being so cold. But on a hot day, when you get a cold drink or touch something cold against your face, a similar sensation could feel really, really good. Temperature is something that also exists as a sensation and an emotion, and those two things combined together will really affect the way that you feel about it. Why this is important with pain is, while we are more likely than temperature to just always be experiencing pain as negative, some people have various quirks that mean they might enjoy certain things. Spicy food would be the most common one. But when it comes to our emotional state, actually, we can have bad days of high stress, days when other things are going wrong, and that will actually make pain feel more intense than on a day when we didn't have so much bad things going on. If you're somebody who works with their body physically, there's also an element of this in your day-to-day life, is that when you get an injury, when you start to worry about the fact that this might compromise your ability to do your job, it's very likely that you're going to experience more pain than somebody who doesn't rely on their hands or their knees or whatever. When they get injured, they say, that's annoying. But it's not really affecting my livelihood. So their stress levels actually might be lower, and they can deal with the emotional side of things a little bit better. So understanding this goes a long way to improving your ability to deal with pain and injury, because if we can teach ourselves not to initially jump into that state of stress and panic and worry, and remind ourselves that, as I've already said, most pain is going to resolve itself, most injuries are going to resolve itself. And if we can just allow ourselves to relax and kind of ride it out, a lot of the time we'll find that actually the pain doesn't become as severe, and we get through it a lot quicker. Or, if it does keep getting worse and worse and worse, then we know that if we haven't added any additional stress on top, then okay, maybe this is time that to go get that checked out. But if we're adding stress and worry and negative emotions on top of the sensation that we're feeling, it's very likely we're going to get a worse experience overall. Principle, number three, is that pain is individual to everybody. On all the research that people do when it comes to pain, it's almost impossible to come up with like a universal indicator of this is how much something should hurt. You might get asked this, by your doctor or your physio if you're going for checkups in pain. They have their own reasons why they need to, ask for this on a scale. But one of the things that 99% of the time now they're not doing is diagnosing you based on the severity of your pain, because what we've now started to realize is that pain actually is really hard to categorize. The same stimulus to multiple different people is likely going to feel very, very different to everybody. Similar to, like, we don't know, do people see colors the exact same, or do people perceive the world in the exact same way? Same thing goes with pain. We can't actually predict how painful somebody's going to describe any kind of stimulus. The way that people develop is going to influence it. Your genetic predisposition to pain is going to be one part. The injuries and experiences from your childhood through to your adult life is going to influence it. The context is going to be really important. So, you could give someone a little cut on the palm of their hand, and you could do it with a knife, or you could do it with the head of a snake. And depending on their relationship to knives or snakes, that might cause the exact same amount of damage to really massively affect their reaction to it. The stress side of things and the worry side of things we've already talked about with emotions, but all kind of pain is going to affect people differently. And so it's really, really hard to diagnose somebody's issue, condition, complaint, whatever's going on, by just asking, well, what kind of pain is it? How much pain are you in? There's a little bit we can do in terms of, if we know if something sounds more like nerve pain, then maybe that might tell us something than if it sounds like receptor pain or visceral pain. But outside of that, it's really hard to draw any conclusions from someone saying this is how much it hurts. We need to find more information about, like, what's going on in your life. What kind of restrictions are there to your movement? How is it affecting you psychologically? How is it affecting your diet and nutrition? Or how are all of those things affecting your pain? So pain is going to be very individual to every person. When you see any healthcare practitioner that says, well, it's just this, it shouldn't hurt this much, that is now very outdated way of thinking. And you should probably go look for a second opinion on that. Okay, and then we get to the final aspect about pain, is that pain uses up a lot of energy. Pain is what we call an unconscious decision from your body, which means your brain, not you consciously, like not the you that thinks and decides things, but the autonomic nervous system has to make a decision when it gets information from, your body, your environment, all of that, about whether or not it's going to give you the sensation of pain. Why is this important? Well, making decisions uses up a whole lot of energy. And when your brain wants to save energy, traditionally it prefers to conserve energy anywhere it can to maximize chances of survival. Then what your brain's going to do is it's going to start making habits. So if you've got tissue damage in your shoulder, so you've torn something, ripped something, something even very mild that's happened in your shoulder, and you try to lift your shoulder up overhead, that causes the threat receptors to send up their information, and the brain says, hey, I want to allow this some time to recover. Let's send a pain response down so you don't move your shoulder so much. Well, you'll probably find that you're not going to completely stop moving your shoulder. So maybe good 100 to maybe 1,000 times a day, you're going to reach your arm up over your head, and then you go, ow, oh yeah, that's sore. Well, your brain's taking note of that as well, and your brain's going to start thinking, okay, every time we go to move the arm, we end up having that threat response come up to the brain, and then we end up deciding to send pain back down. What would be really useful for me is every time I decide to move my arm, I'm just going to fire that pain response, or I'm just going to get that pain response ready so that the two things happen in tandem. So I don't have to make a decision anymore and go, oh, we're getting that threat response. Should we send the pain down? We can say, nope. Every time we get that every time we get the request to move in that way, we're just going to fire pain along with it. And over time, if that doesn't cause any major survival problems, then that just becomes a habit. And this is what mostly is going on when we're dealing with chronic pain complaints is, after that 3-month period of tissue damage, you're almost guaranteed that everything is now back to normal. But your brain has now learned to behave differently. So it's learned to fire pain responses all the time for certain things. It's also learned to move differently. So you might actually still be getting more threat responses from the fact that you've changed your posture, you've changed the way that you physically move. And that's just the brain's way of saving energy. So it's saying, you know what, unless you're going to do anything big about this, I'm just going to keep you moving this way. And your brain can keep you in pain because pain uses up energy. It is a conscious decision the brain has to make. And because of that, you might find that you end up getting stuck. That's sort of the fourth principle. The other interesting thing about pain being a decision, some people say, that doesn't sound quite right. Surely every time something hurts, it should hurt, right? Not necessarily. So one of the things in the military people get taught nowadays to do is, once you get to cover, if you're being fired on, check your body, try and see if you're bleeding. Because the adrenaline that you're experiencing, the brain says, you know what, if you receive any injuries, that's not as important as getting to safety. So I'm just going to ignore any threat response, any danger response. Many of you will have the experience of, you bang your elbow off something, you don't even notice, and 3 days later, you notice you got a big bruise there. And it doesn't hurt until you start to poke it and start to play with it, then it starts to hurt. But before that, you were actually quite content and you didn't actually notice that anything was going on. So that's kind of an example of how your brain can decide not to give you pain. And it's important for it to be able to do that, because if you felt extreme pain in a survival example, or when it's mild pain and it's just not that important, then that could potentially have more drastic implications for you further on down the line. Similarly, the principle that, pain is an alarm, you could have something that doesn't physically damage you, but that looks like it should, and have you experience the associated amount of pain from that. So there's interesting story in the kind of medical literature of a guy who steps right the way through a big long nail getting down off a ladder, and he's wearing big boots, so they didn't want to remove the boot in case they caused any more damage. So they get him in the ambulance, ask him about his pain levels on the pain scale, and he says, 10 out of 10, I'm in the most pain I could ever be in. When they get there and they x-ray him, turns out the nail didn't even go through his foot at all. It missed between the toes, but his brain, on seeing this is what's going on, it then checks in with the foot and says, are you experiencing any tissue damage? And the foot says no. And the brain reassesses that and goes, well, that's not right. I better send an alarm down to get the body to pay more attention, because something's seriously wrong here. So this is one of the reasons why, understanding about pain can be so helpful, because it's a lot more complex than just feeling pain means something very definable is wrong with your body. So those are the 4 principles. What kind of information can we take from that? So one is that pain is not to be ignored. It doesn't mean 100% that something is seriously wrong. It doesn't mean that there is specific damage, but that doesn't mean that we can then ignore all pain. And actually, I would argue we probably shouldn't be ignoring any pain. Anytime we have pain, we should take it somewhat seriously, but just not in the way that you might think. It's not through stress and panic and worry. It's through, your brain has just asked you to pay attention to this part of your body. So why not pay attention to this part of your body? The reason that's useful is then that gives you an idea of whether you actually need to go get this seen to or not. So the vast majority of all injuries and tissue damage and things that are going on in your body are just going to clear themselves up over time if you give them enough time, up to, the maximum is about 3 months, but most of the time within a few days you're going to start to see some physical changes to your injuries. And if we can remain calm and be vigilant, listen to when our body gives us pain and not push through it and ignore it, those injuries are going to improve themselves over time. Okay. Now, this isn't including if you're already dealing with a chronic complaint. We're going to talk about that after. If you're dealing with pain that just keeps getting worse, so every day, every time you experience it, it's getting worse, 100%, I would not try to self-manage this. I would want to go get it seen to. If you're dealing with a pain that is the worst pain you ever experienced, once again, I would go get it seen to. If you can come up with a really good reason why you might want to get it seen to, so you've had a fall, you can visually see something has changed. So it might be you've slid across the ground and you're bleeding, so that's a sign maybe I want to go make sure I don't need to get stitches or something like that. You might have a photo of before and after, and physically it looks very different. So a little bit of swelling, maybe nothing to worry about. But if it's visibly depressed, like higher or lower, or a really huge amount of swelling or something like that, when the visual changes are really profound, then again, go get it seen to. Same goes with bruising and any other kind of visual things that are showing up. And yeah, I guess pretty much those are going to be your telltale signs. If in doubt, also, like, you're sitting on the fence where you're like, all right, well, I've given this a bit of rest. I'm still a bit worried. I don't feel like I have the tools to deal with this. Then again, anytime you're in doubt, go get it seen to. But in those situations, what I want to do now is talk through 6 strategies that you can use that might improve your chances of seeing the recovery get better. So we said that education is one of the most useful things when it comes to improving pain. The second thing that was really useful was movement. So we're going to talk about how to use movement to self-manage your pain in 6 different ways. And first off, we're going to say the first principle, and the one that you're going to use the most, is to move everything that isn't painful to move. Okay, so if you've got pain in your shoulder and moving it causes pain, you're not going to move that shoulder. Okay, you might find that you can do some movement without pain. Stick to that. That's perfect. But the things that actually do hurt to do, especially in that first kind of 3-month period, so where you're testing out to see, does this get better? You don't have to push into the pain. You don't have to test, does this still hurt? You're just going to start moving the rest of your body. So anything you can move without pain, you want to be moving. Why? This is going to improve your blood flow. Okay, so it doesn't have to be intense exercise. It doesn't have to be stuff that's difficult and stressful and uncomfortable. It's just, if you can walk, go for a walk. If you can move the other arm, it doesn't even have to be like a specific gym looking thing. Just move it around as much as you can. Any part of the body. You can move your head, then move your head. You can move your mouth, you can move your toes. All the things you can move. The blood flow increases a little bit. As the blood flow increases, you get more chance to improve any kind of tissue damage. So, there's going to be certain nutrients, there's going to be all different fluids that need to be delivered to that area. If your blood flow is slightly increased, you get all of it delivered a little bit more quickly. So, whether it's something that's broken or whether it is something that is just mildly grazed or sprained or something like that, the advice is still the same. Is if it hurts to move it, you probably shouldn't move it, especially in the first week or so where you're seeing, does resting this area cause things to improve, but the other stuff can still move. Don't put yourself in a dangerous situation, where you might fall and then re-injure. But movement other places can be really good. Specifically, when it comes to the limbs, especially, but can be in the trunk as well. Movement on the opposing joint can be really helpful. So for the right arm, we're going to look to the left leg, and for the left arm, we're going to look to the right leg, and vice versa. So if it was the right leg that's in pain, then we would move to the left arm, and the left leg would move to the right arm. And just treat those joints as like mirrors. So if you find you've got pain in the right shoulder, you're probably going to get maximum benefit from doing a lot of movement in the left hip, assuming the left hip is not also painful. Same goes, if you've got right knee pain, then we'll go to the left elbow. Left wrist pain, we'll go to the right ankle. Just treat these joints as like mirrors of each other. This, again, is going to improve blood flow, just like we wanted before. But there's also some reflexive actions that go on here. So when you walk, your brain has lots of reflexes that connect the right arm to the left leg and the left arm to the right leg. And so all the time when you're walking, that reflex gets stronger and stronger and stronger. So the same way I said that pain can be a habit, so when you just always lift your arm up and the brain says, okay, I'll just make it hurt. Your brain also gets used to the fact that you walk more than you do pretty much anything else. So every time you have that right arm swinging forwards, your left leg says, I'm probably going to swing forwards right now. Even if you're sitting down and you move your right arm forwards, your left leg gets ready as if it's going to do that forward swing, just because there's a good chance that that might actually happen. So the muscles get primed, the nerves get primed. When you start training the left hip, you can sometimes improve your right shoulder pain just by the fact that you're firing that reflex. So you're getting the muscles working because they're getting primed and relaxed without actually having to physically move that part of the body. Similar to this, if you've got some kind of injury to your right arm doesn't move so much, moving the left arm can also help quite a bit. The two nerves, so the nerves on your right arm connect to your spine and they're right next to the nerves on the left arm. If you start moving the nerves on the left side, they start tugging on the spinal cord, and that causes little bits of tugging on the right side. And again, it can just prime that side of the body for movement. So that's concept number one. That's kind of the most complicated one that we're going to have. So I put it in first, but it's also the one you're going to use the most when stuff hurts. Move everything that doesn't hurt. Okay, so move everything that doesn't hurt to move. And if you want to be more specific, you can go to those opposing joints or even just the other side of the body. Let's simplify it a little bit now. So concept number two, this is the only one where we're going to take the movement away. Instead of actually moving the joint, we're going to employ what's called a sensory override. So if you've done a first aid course before, or you've been treated by a first aider, one of the first things that they're going to do is put ice on the affected area. I'm always using the shoulder just because you can see my shoulder. But they're going to get that ice pack, they're going to put it on the shoulder, and what they say is that's going to reduce the pain, it's going to prevent inflammation. Don't worry if you've done loads of research and you're hearing people say that the rice rest ice compression elevation isn't a good tactic. Just remember that this is taught in first aid courses because it's a good tactic the moment that you get injured, because you don't know what's happened. So when you want to treat an injury that's just happened, that's why they do it. If it's later on down the line, actually, you might want that inflammation to encourage recovery. So they're two very different things, but we're not going to be talking much about that today. We want to talk about the temperature aspect specifically. So when somebody puts an ice pack on your sore shoulder, what is going on there? Well, your spinal cord can take a certain amount of information up to your brain. The information of like tissue damage or threat or whatever, that is going to travel up the spinal cord when you get injured. But if you put something cold on, then now there's more information that needs to travel up. So the brain has to work out which information is more important. Is it the tissue damage or is it the temperature? And interestingly, for some reason, the tissue damage information just travels slower than almost every other sensory information that there is. So when you put temperature on top, your brain says, well, what if there's more danger coming because of this new temperature information? So it sends the temperature signal up first, and that makes it more difficult to get the information about the tissue damage to come up to your brain. And what that means is with temperature, you get this little sensory override where you start blocking the painful signals from getting all the way up to your brain. If you've been in pain for a long time, especially if it's a chronic pain complaint that's lasted for longer than 3 months, you could very much get some great benefit from adding this sensory override. If it's a brand new injury, you might not want to stop the pain signal because, again, that's your brain saying, I want you to pay attention. But once we have the pain sensation for long enough, there's a pretty good chance that this has just become a habit. The pain signal is just traveling up to your brain constantly because it's got used to doing so. By adding the temperature or any other type of sensation. So it could be like rubbing, vibration, pressure, anything like that. You can start overriding that stimulus and just having your brain get used to the feeling of no pain because it's paying attention to all the other sensations that are going on. So any kind of pain that's been going on for a long time, especially longer than 3 months, sensation is going to be your friend. It's a really great way to override those pain signals that might be stuck in a kind of habitual pattern. And that might help teach your brain that it's actually okay for it to start easing off on these pain signals. On a similar note, so concept number 2, that's it, done and out of the way. On a similar note, we'll move into concept number 3, and that is about this like priming thing. So remember when I said lifting your arm up, your brain starts saying, anytime I get the message of lifting my arm up over my head, I'm going to fire that pain signal. Well, what'll happen is every time I go to lift up my arm up over my head, and let's say I can get to here pain-free, but as soon as I go a little bit further, that's when the pain signal kicks in. Well, every time you think about moving your arm or moving your arm, your brain says, get the pain signal ready. As soon as we get to 45 degrees, we're going to need to fire it. So you start to move your arm, and then we get to 45 degrees, so the brain fires it, and then you go, ow, and then you put your arm down. And your brain's conclusion to this is you put your arm in the bad place, I fired the pain signal, you put your arm back down, and nothing bad happened. So that must mean that I'm justified in continuing to fire this pain signal. Every time you look for where it's painful, every time you go into that painful position, you're basically just reinforcing to your brain that it's a good idea to keep firing this because you're getting there and you're not causing yourself any more harm. So it comes to this conclusion like, this pain signal is doing a good job because when I didn't fire it, I got hurt, whatever caused the injury. But now, every time you do it, I'm not getting hurt anymore. So this is a really good thing. How can we override that? What we need to do is teach the brain that actually it was wrong in assuming that this pain signal was going to be needed. And the way that we do that is by aiming for 100 to 1,000 pain-free reps of that movement. So if it hurts me to lift my arm over my head and the pain starts at 45 degrees, then I'm going to start moving, but only go to 44 degrees or lower. So you don't even have to get near where it hurts. You could go, I'm just going to lift my arm to 30 degrees or 20 degrees and back down. And the series of events that happens there is your brain says, you're about to move your arm. I'm going to need to get that pain signal ready. And then you're going to move your arm nowhere near where it's going to fire the pain and put it back down. And then it says, ah, you didn't need the pain signal. Interesting. I just wasted some energy getting that ready. And then you're going to do it again. And you're not going to experience the pain because you didn't go far enough. And the brain says, I just wasted energy again. And if you do enough reps, over and over and over again, where you never experience that painful stimulus, then your brain's going to say, hey, actually, maybe I'm using up more energy getting this pain signal ready than I am if I just didn't do that. And it's going to start to decouple those two things. It's going to start separating the pain and the movement. And eventually, what you'll find is eventually you're going to start being able to get closer to where it should be painful. Because then as you get closer and closer to that area, now the brain's waking up. It's starting to make that decision. Probably it's going to fire the pain signal again. But again, you just go for those pain-free reps in your new range. Okay. Now, the way I normally tell people to plan for this, if it's a very basic movement, so, lifting your arm up over your head is pretty simple. I would say you want to go for 1,000 movements, 1,000 reps of that movement in a day. So you just lift your arm to where it doesn't hurt, to where it doesn't hurt, to where it doesn't hurt. And then, do whatever you want in the day. You're probably going to put your arm in a painful position a few times. But if you've got 1,000 times where it didn't hurt, that's going to outweigh the, 10, 20 times when it did. If it's a really complicated movement, so let's say it's like a full body movement, like a squat, where you're trying to reach down and touch your toes or put your shoes on or something like that. Again, you're going to find how far can you go where it doesn't hurt, and you're just going to do that. But we'll say probably 100 reps is going to be fine. It's going to be a lot harder to do that 1,000 times. You can do it all in one go. You can do it sporadically throughout the day, but we're going for 100 to 1,000 pain-free reps. That's going to start teaching the brain that it's actually more energy expensive to get the pain signal ready ahead of time than it is to decide when you get there.